I want to bring in Chief White House correspondent Major Garret, who was in the press briefing room. Major, so many Republicans were against this House bill. I'm curious what the White House is willing to bend on when it comes to this bill.
Well, what we had today was news of an incremental nature about the White House approach to the House health care reform bill, the one to repeal and then replace the Affordable Care Act. And that is they're in support of a manager's amendment, which is one amendment that may be brought together at some point in the process to take the bill put before the House by Speaker Paul Ryan and approved by the Energy and Commerce and the Ways and Means Committee, and then add things to it. Now, Sean Spicer denied what is obvious when you're open to a manager's amendment. I stated it, he denied it, but that doesn't mean it's true. Whenever you're willing to have a manager's amendment, you're amending the underlying legislation because you don't have the votes to pass it. If you support legislation, which the president did last week, and you have the votes, you don't write a manager's amendment because you don't have to. The president's support last week is contingent upon what? Being able to pass the legislation in the House, because without that, you have no hope of moving this through the Senate and eventually getting it to the president's desk for signature. So, the White House now saying for the first time publicly it will be in favor of and help the House Republican leadership draft a manager's amendment means it is going to change the underlying legislation in some significant way, probably to move it more in the direction of the House conservatives and the Freedom Caucus, who are not on board and who are not willing to support the legislation as drafted, and who stand as a political fulcrum denying the president what he wants, which is a legislative victory in the House to keep this momentum going. And without that momentum, not only does the Affordable Care Act repeal and replace stall, but with it, this White House knows much of its follow-on legislative agenda would probably also stall. Tax reform, building the wall on the U.S.-Mexico border, infrastructure reform. All those things are, at least in theory, stacked up behind a successful maneuver on repealing and replacing the Affordable Care Act. So right now, I think it's fair to argue, everything that this White House is trying to accomplish and all of its agenda for the remainder of this year domestically is dependent upon its ability to work with the House Republican leadership and get this bill through the House and get it through the Senate. And they are now acknowledging the original legislation can't do it because they're going to draft a secondary amendment to move it along and probably make this bill more conservative, not less. And the reason that's important is because if, in fact, the bill that emerges from the House is more conservative than the one that currently exists, it will face even more resistance in the Republican Senate, complicating the president's strategy there. But you don't have a Senate strategy if you can't get it through the House. And the White House now is moving very strongly and publicly for the first time on behalf of a strategy that takes this bill to the right and make it more conservative and will deal with all the complications that they know will come from that later.
Major, with all of that said, during the 2016 campaign, we witnessed President Trump, who was obviously then the candidate there, sort of go after the Obama administration, saying that they weren't transparent with the American people when it comes to Obamacare, and also some of the GOP leaders and Republican members as well. Does it appear now that the tide has switched, and now this administration is not being transparent?
Well, it's like every administration I've ever covered. They are all in favor of transparency in theory, and they're very much in favor of defining transparency on its terms. But they're not in favor of transparency as defined by their political opposition or public interest groups or journalists, for that matter. So there's a couple of key questions about transparency for this administration. I asked Sean Spicer about the so-called Phase 2 of repealing and replacing the Affordable Care Act, which a lot of it is within the hands of the Secretary of Health and Human Services. A lot of administrative and regulatory power falls to that secretary. And that's the way the Affordable Care Act was written. It placed a lot of power on the implementation of the act in the hands of the Secretary of Health and Human Services. And Democrats loved that when they ran the White House and they had a Democrat running the Department of Health and Human Services. Well, now that shoe is on the other foot. Republicans are in the White House, and a Republican, a conservative one, is running the Department of Health and Human Services. And so what this White House is saying is this Republican leading the Department of Health and Human Services is going to tighten down all of those things in the Affordable Care Act to create more choice, more options, but maybe not as much coverage, and do it all through the power of that administrative deference. What we don't know, and this is the transparency question, what is that going to be? Will you tell the American people all the things you're looking at and all the things you seek to change through your administrative power? Sean Spicer was at least open to that today. He didn't rule it out, and he said it's something that's probably a good idea, and the more that people know about the process we're going to go through, the better. That's at least a nod in the direction of transparency. But until we see it, it's not transparent.
We heard Spicer say, Major, it's going to be unbelievably difficult if this doesn't pass through in the next few weeks. Talk to me about the House Freedom Caucus, a conservative group. What is it they want, and do you think compromise can be reached?
Well, a couple of things that they want. They look at the Medicaid allocation, which under the Affordable Care Act goes at a certain ratio and a certain repayment schedule until 2020. They think that's too generous. They want to scale that back and give states block grants and say, you figure out how you want to handle Medicaid. We'll give you a lump sum of money, but we're not going to spend as much money as the Affordable Care Act under the current schedule has, and we're not even interested in having it paid out until 2020. We want that to stop next year. Whoa, stop that next year. What's next year? A midterm congressional year. A lot of Republican senators and some House members from swing districts, meaning much more closely divided districts, Democrat and Republican, are a little nervous about that because they don't want to be chased around their re-election campaigns by headlines and stories of people on Medicaid who had health care services and health care coverage who are losing it because this has been changed. But the conservatives want that, to save money and to get the federal government out of that obligation to pay for Medicaid financing for many years forward, even if it's just 2 more years from 2018 to 2020. That's one of the big asks they want. They also want more explicit language in the legislation about this idea of insurance being sold across state lines. They'd like to see that in the legislation. Problem with that is, and I'm going to get a little deep in the weeds, so please forgive me for what I'm about to do. But in the Senate, you have a reconciliation process. That's under certain budget rules. I'll gloss over all that. All you need to know is, if it's a budget rule, it has to have dollars and cents attached to it in relationship to federal spending. And if it doesn't, it can't be in the bill. That's a tight little description of the problem. So, writing legislation that says you can sell insurance across state lines has no direct budgetary impact one way or the other. And that means it can't be in the bill and get through the Senate on a 51-vote process. You have to take that into a separate piece of legislation and get 60 votes for it. That becomes more complicated, especially if Democrats are no way, no how are we going to support any of your efforts on the Affordable Care Act repeal and replace. So if they walk off the reservation, if they're not part of any of those conversations, you can't get to 60 votes. And you can't get this change on providing the freedom for insurers to sell plans across state lines, because it can't go through that 51-vote process because it has nothing to do with federal spending as defined by the budget rules. That's deep in the weeds, but it's one of the things they want, and it's one the White House is trying to figure out a way if they can write it in the bill and protect it in the Senate. They don't know if they can. They don't know if it's even possible, but they're at least willing to listen.
All right, our Chief White House correspondent, Major Garret, thanks a lot for breaking that down for us. We're going to call him our fact checker as well. I know Spicer was sort of picking at him. Thank you, Major. We appreciate it.
You got it.